Metro on 1019 WDET FM. I'm Tia Graham. Now, the U.S. healthcare system hasn't been great about taking care of expectant mothers, especially moms of color. Black and American Indian moms are most likely to die as a result of giving birth. And in Detroit, a lot of expectant moms face grim outcomes in a number of ways. The city had the highest preterm birth rate at over 15%. That's according to a recent report from the March of Dimes. These statistics speak to a larger problem. People of color, especially Black women, face roadblocks to accessing health care more broadly. They also have worse outcomes for a lot of health issues, and that is because of things like racism, financial barriers, and historical trauma. But local efforts are underway to improve maternal health care and child poverty, including a restriction-free program that gives money to expectant moms. RX Kids started in Flint last year. Now is expanding to Wayne County, where pregnant moms will get $1,500 during pregnancy. To help combat child poverty, they'll get another $500 a month for the first 6 months of their baby's lives. Pediatrician Dr. Hanna created the program. She helped expose the Flint water crisis and its devastating effects on kids. Her work with RX Kids continues her sharp focus advocating for families in underserved communities. Dr. Hanna, welcome to the Metro.
Oh, it's so wonderful to be here with you, Tia.
And we do want to hear from you all that are listening. Are you pregnant or have you been? And what was your healthcare experience like? The phone number is 313-577-1019. So, Mona, before we look more deeply at RX Kids and the impacts it could have here in Wayne County, I do first want to talk about the origins of the program itself. You launched it last year in Flint, and now it's also in Kalamazoo, part of Upper Peninsula as well. What experience did you have practicing medicine yourself and interacting with patients helps you dream up RX Kids?
Tia, that's a wonderful question. So I have the greatest joy in the world of being a pediatrician. So I get to take care of our kiddos every single day. And so much of my job as a pediatrician is making sure that they're healthy. And, you know, we give their vaccines and we check their growth and their development and we make sure that they're safe. But so much more of my job as a pediatrician is making sure that our kids have the healthiest future possible. But that's really hard when our babies are born into communities where they just do not have the resources to succeed. For so long as a pediatrician, I have wished the ability to go into my doctor's bag and prescribe away an antidote to poverty. Poverty is a pathogen. It makes kids sick, and it impacts, once again, their entire life course trajectory. So it's something I have wished for. Healthcare, the way it is right now, is a sickness-based system. We spend a lot of money after the fact, but we don't spend as much on preventing things like poverty, making sure that we have clean air and clean water and the infrastructure, the societal infrastructure to make sure that our kids are growing up healthy. So it's something I've wanted to do for so long, but literally have shrugged my shoulders. I'm like, wait, we can't fix poverty. How am I going to fix this big problem called poverty? And then in 2021, we as a nation did it. We expanded the child tax credit during COVID, and millions of kids were no longer in poverty. And we saw all these amazing health outcomes, and we became like so many other countries. And I'm like, oh my gosh, we did it. This is, once again, a policy decision, and we did it. So we're going to do it here.
Yes. And, you hit on something that was really, important there, of all of it, of course. But when you talked about poverty and that being just such a dire thing when we talk about health, and I think about how expensive it is to be poor, that we hear that oftentimes.
Absolutely.
Can you expand on that just a little bit, that idea of how much it actually costs to prevent some of the health outcomes we see due to poverty?
Yeah. So, I see this once again every day as a pediatrician. Missed appointments because families can't come in. They don't have the bandwidth. They don't have the time. They don't have the transportation. Babies who are too small or failure to thrive, or childhood obesity because they don't have access to healthy food. Developmental issues, increased risk of chronic diseases. Poverty is this root cause of almost anything you can think of in health. It is this root, what we call social determinant of health. And we've been band-aiding it. We create after the fact programs. We're like, oh, sign up for this parenting class, or do this, go do this home visiting program, or do this or do this. But we don't fix the real problem, which once again is poverty.
Poverty. And so, Mona, now let's talk a little bit about how and what has happened since you've launched the program last year. What have you seen in terms of participation, in the positive things that you've been able to see in terms of participation?
Oh, I can't wait to share this. So, ARCS Kids is crazy, right? Like, we are giving every pregnant mama and every baby in a poor community unconditional cash. It's wild to think that we are doing this. We are the largest cash transfer program of its kind in the country. We are the first in the nation. Nothing like this has been done anywhere where it's for an entire community. But when you think about it, like how unique it is and how novel it is, when you actually look at what the rest of the world is doing, we are anomalous.
Yeah.
This is done throughout the world. There is massive global evidence that this works. That when you give families, especially with young children, cash, and they determine how best to spend it, that amazing outcomes improve. So this is once again based on 70% of countries in the world do some sort of child cash transfer. And what we know from that evidence is that child poverty decreases. So you have improved things like housing stability. You have improved food intake and satisfaction. You have less stress. Families have that bandwidth to be parents and to go to doctor's appointments. So they have improved healthcare utilization, and then also better maternal infant health outcomes. So that's the global evidence. So what are we seeing already? So it's ARCS Kids launched in Flint in January 2024, and we didn't have to do any research. Like, we didn't need any more science. But like, okay, fine, we're academics, we'll do science. Like to squish the naysayers, and we are finding that our evidence is consistent with that global evidence. The first wonderful statistic that we have is that we have a near 100% take-up rate. And we achieved that fairly quickly. That means almost every single family, every single newborn in this program that can be in this program is in this program. That is amazing. If you look at other programs in this window of life, like WIC, which is this really important maternal infant nutrition program, WIC nationally has about a 50% take-up rate. Only 50% of the families that can be in WIC are in WIC. Home visiting programs like Nurse Family Partnership and the Maternal Infant Health Program have about a 20 to 30% take-up rate. But our program, this easy to administer, already built program, built on global evidence, very quickly had a 100% take-up rate.
And I do have to jump in on that because that is so significant. I don't think folks understand there are so many resources that are out there, but a lot of the times people may not know how to get access to that, or they may not even feel as if they qualify for it. Or there's so many just different barriers to some of these obstacles and barriers. I want you to expand on 100% because that's a huge number.
It is huge. And for so long in my career, I have been working to find hard to reach families, or why aren't these people signing up? Like, we have this great breastfeeding thing. Like, why aren't people coming? But when you design something in a way that is so simple to understand the eligibility, it is for example, in Flint and every community that we're in, it's for everybody. It is universal. So it's not just for those who make a certain amount of money or for first-time moms or high-risk moms. It is for everybody. So the eligibility is really easy to understand. It's for everybody, once again, a low-income community. And then it's unconditional. There's not this policing and this paternalism of what people are spending, what they should be doing with that cash. So the design of ARCS Kids is really kind of flipping a lot of what we do in society. It is... a lot of our social services and healthcare programs, they're built with stigma and shame. And this is built with dignity and love. Like, we are literally telling our families that we hear you and we see you and we know how hard it is to be a mama and to raise a baby. It is the hardest job in the world, and we are walking alongside you and we trust you. And that this is a program that gives you agency and empowerment and freedom and choice. And we've kind of coupled those values in a lot of other kind of celebrations in our ARCS Kids communities. We just had, we're having a baby parade. We had a baby parade last summer in Flint. We're having one in Pontiac in May. We have every baby gets onesies that say, you are loved. They get a note from the governor that says, welcome our newest Michigander. We're so happy that you are here and we can't wait to see what you grow up. So we are loving people. And that is not something that's happening right now in the world. And this is a program that is full of joy and celebration. And I think the values embedded in the design and these other messages that we are sharing is helping us achieve that 100% uptake rate.
I mean, once again, when you say that, and I just think about all the programs that we often talk about on the Metro and how folks have issues getting people to sign up or just join or be a part of something that could be beneficial to them. And, it just doesn't happen. So just to hear you say after 1 year of RX Kids in Flint, you have 100.
Oh, no, it was actually after a few months. It was within a few months we achieved that. And we're already achieving that in Kalamazoo and in the Eastern UP.
And we will expand on that just a little bit more as well. But I want to zoom in on Wayne County in particular. I mentioned at the top a few statistics that tell us a lot of moms in Detroit are more likely to face health issues during or after pregnancy. And Detroit has a high rate of child poverty at 44%. So let's talk about how RX Kids is going to help in Detroit.
Tia, that's a great question. So, RX Kids is, once again, this maternal infant program. When we were first talking about, could we do some sort of program in a whole city? We wanted to do it for like all of childhood, like other countries. They do cash transfers, child cash transfers for all childhood. Then we're like, well, let's just do it for early childhood, get them into preschool or 0 to 3. But then we looked at the science, and it turns out the maternal infant window is when families are poorest. So towards the end of pregnancy, moms come out of the workforce, they lose income. Babies are expensive. There's so much that you have to buy to have a baby. And that drop in income persists for the first year of life. So the period of pregnancy, infancy is when families are the poorest across the life course. There is not a poorest. This is an economic shock. So we may have like child poverty rates for a community but families are even poorer around pregnancy. And, we are one of the only country in the world that does not have paid parental leave. That's part of it. We don't have universal, healthcare access. We don't have these structures in place to support our mamas and our babies. Once again, in the richest country in the history of the world, we are abandoning children. And when I first learned that as a pediatrician, that families are poorest in this window of life, like I freaked out, because that is developmentally one of the most critical windows of life. What happens in that brief period literally shapes your entire life course. Babies' brains double in size in the first year of life, and we are abandoning our families. And so it's no wonder that we have a maternal health crisis in this nation. No wonder our outcomes are terrible, that we have such high rates of maternal morbidity and mortality and terrible maternal mental health. It's because our families are not supported.
And our executive producer Dave is actually out because his wife is expecting, and any day now we're expecting to have a new member of the Metro. And
they should move to an RX Kids community.
They actually live in Wayne County, so I think they're good to go. But just expanding on that, I don't think a lot of us, even myself, sitting here now, and you talked about that, didn't understand the importance of what that meant in that crucial time, especially when you're first having a kid, and then those months after, how much of an economic impact it has on folks. So can you expand on that? I had no idea.
It is once again the greatest economic shock of your lifetime. Once again, moms don't make as much money. They often have to go on leave, to take care of while they're pregnant, to take care of their baby. It's also estimated that you have to spend an extra $20,000 in that first year of life. We've asked our families, like, what are you spending the money on? In 2 surveys, and it comes out, once again, baby supplies are number one. The number one thing that our families are spending their money on is baby supplies. And when you break that down, it's changing supplies, it's diapers and wipes, and then it's like feeding supplies. So baby supply, you think about all that stuff, car seats and strollers, and all these things that you're supposed to have. It's like the smaller the kid is, the more stuff that you need. And then we're not even talking about the cost of childcare. So all of these things, these are impossible expensive, and it's no wonder that people are deciding like they can't afford to have a child.
Not right now. This is the Metro on WDET. I'm Tia Graham. We're talking about ways to improve maternal health care and child poverty in Detroit. Our guest is pediatrician and professor of public health at Michigan State University, Dr. Mona Hanna. She launched RX Kids, a restriction-free program that pays expectant moms, and it's now expanding to Wayne County. And we do want to hear from you if you have time. Are you pregnant right now, or have you been pregnant? And what was your health care experience like? Give us a call, 313-577-1010. Now, Mona, we're going to get into those concerns about the program in terms of helping underserved communities, but I do want to talk about the rural communities as well, because, a lot of rural communities have less access to healthcare than a lot of us even know about. So let's expand on that and how RX Kids has helped kids within those rural communities.
Yeah. So once again, RX Kids started in Flint, but it was just to figure it out. Just like everything that we have done in Flint, it's like, hey, let's kind of share our best practices, be it about water safety or pipe replacements or environmental justice. Let's learn from Flint, and then let's make sure we can help kids in communities everywhere. So we started this in Flint. We figured it out. We built it. And then Governor Whitmer actually included more money for RX Kids to expand it to other communities. RX Kids is a public-private partnership. We have some money from the state, but we have to raise even more money to make it possible in other communities. So right away, the city of Kalamazoo was really excited. They have lots of wonderful place-based philanthropy, and we were able to launch this in the city of Kalamazoo. But we wanted to make sure that we could do it in different kinds of places in Michigan. We wanted to make sure that we could do this in rural communities. And rural communities, as you said, have different challenges. There's very few birthing hospitals. It's hard to get anywhere. It's really cold up there in the UP. But they don't also have the nonprofits and the other infrastructure, the helping infrastructure that we do in our bigger cities. And the neat thing about RX Kids is that there's no local lift needed. It's pretty much a no-touch program. Families sign up on their phones. It's a mama-tested application that takes 10 minutes. They upload verification of pregnancy and residency and childbirth, and then most families get a direct deposit into their checking account. So we don't have to hire people. There's no staff. There's no bureaucracy. It is such a lean and efficient program. We launched in 5 counties in the Eastern UP. The Eastern UP is actually kind of the poorest part of the UP. Lots of those challenges of rural poverty, a high Native American population. We work really closely with the health departments up there, as well as the Sioux tribe and other kind of indigenous folks. And we launched in March, and once again, it has gone seamlessly, near 100% take-up rate, and people are just so excited. People in rural communities and our bipartisan legislative champions up in the UP are so grateful. They felt left out. They're like, oh, the cities get everything. What about us? We finally feel seen. We finally feel heard. And this is finally kind of helping our families and our entire community.
And I just, love the RX Kids model. I love the idea of it. I have so many folks in my family right now, a few pregnant folks in my family. Like I say, so many, but I have a few pregnant folks who will definitely benefit from RX Kids. So I'm hoping that they're listening. I'm going to send this link out to them. But we do want to talk to you. Just last question before we let you go. Something central to RX Kids program is that you believe moms deserve support without restrictions. You talked a little bit about it, without that burden there, that feeling that I am less than because of this particular program. So let's talk about your response to that. What should people push back on when we say that, the welfare queen, quote unquote?
Yeah, so those are just all racist, sexist myths. And if we add any kind of conditions or requirements on programs, it's going to cost more to administer. And, evidence over time on so many research studies globally and in the U.S. shows that when you trust families, when you give them that flexibility to meet their needs, they do what they should be doing, what's best for their family. Some families need housing, and some families need food, and some families need food, but they're okay with transportation. Giving this unconditional cash, which is once again based on global evidence, helps meet all those different needs for individual families.
I just think about a mom opening her phone, getting the $1,500 when she goes through the process, and immediately going to buy things she needs for when she's going to have her child.
This addresses the acute needs. It's not something you get in a tax credit. This is addressing those acute economic needs of this, once again, this window of life when families are the poorest.
Dr. Mona Hanna is a pediatrician and a professor of public health at Michigan State University. Her program, RX Kids, which gives money to expectant moms, is expanding to Wayne County. Dr. Hanna, thank you so much for joining us on the Metro.
It is a joy to be with you.
Coming Coming up, we'll learn about more ways local healthcare providers are taking matters into their own hands to help pregnant moms stay healthy. And we do want to hear from you. Are you pregnant or have you been pregnant? And what has your healthcare experience been like? Give us a call, 313-577-1019. This is the Metro on WDET. Stay with us. Welcome back to the Metro. On 1019 WDET FM, I'm Tia Graham. And we've been discussing the challenges that pregnant moms face in getting the health care they need here in Wayne County. It's a problem that's especially acute for some moms of color. Black and American Indian moms are most likely to die as a result of giving birth. And this speaks to a larger problem. People of color, especially Black women, face roadblocks to accessing health care more broadly. Some healthcare providers have been actively chipping away at these issues. Dr. Philip Levy is a professor of emergency medicine at Wayne State University, and he directs the Wayne Health Mobile Unit. It takes healthcare on the road, and it brings it to pregnant moms in low-income neighborhoods in Detroit. This week is Black Maternal Health Week, so we invited Dr. Levy back to the Metro to discuss how he's bringing healthcare to the doorsteps of not just pregnant moms, but all folks across the city. Dr. Levy, welcome back to the Metro.
It's so good to be here, Tia.
So you launched the Wayne Health Mobile Unit as a solution during the pandemic. I remember talking about that with you when it first happened. It provided COVID tests and vaccines. Now let's talk about how that effort has expanded and grown since then.
Yeah, we're nearing our 100,000th encounter since we started doing this. It should happen in the next couple of weeks. And we've taken what started out as a pandemic response and developed the first in the nation vision of portable population health. So how can we meet people where they're at in the community, bring them screening and linkage services for the things that we know cause the most morbidity and mortality in our populations.
And, just listening to Dr. Hanna speak and just learning a little bit about what's been going on, there needs to be solutions put into places in so many different aspects when we're talking about healthcare, mobile healthcare, and Black moms. So let's just talk a little bit about Maternal Health Week, Black Maternal Health Week. I'd like to talk a little bit more about what you have seen when you're treating moms, especially Black moms in the neighborhoods, and the need for these services.
Yeah, absolutely. So what we do find is that, a program like Dr. Hanna's can really help people get the resources they need to attend prenatal visits, go and get ultrasounds before, they deliver. Obviously, we know a lot of women in the community lack access, and they lack the resources, even if access is available, to make appointments. So having the financial resources to do that's really important. But alternatively, a lot of folks have had negative encounters with the healthcare system. It doesn't always seem the most inviting thing. And so we've tried to reimagine that by bringing services into neighborhoods, into communities, through trusted resources and partners like Durfee Innovation Society and Adams Butzel Recreation. We've started to expand what we do, Alternatives for Girls or other partners that we work with. And so when you have trusted agency in the community, you can go through that, and women will come out and realize that they're not getting services that are inferior because they're mobile. They're actually getting services that are on their terms in their location where they want to receive them, and they can be equally, if not, better level of services than they would get in other settings.
And talk about the crucial importance of having that partnership with those community groups and organizations, because without that, you're kind of just driving into communities trying to figure out how to interact with, but you have that connection that kind of lends to that. So let's talk about that community you've been able to cultivate in order to reach some of the really hard populations of people to reach.
Yeah, so we've now partnered with almost 250 different community organizations since we started this work in April 2020. But when you're going through a community partner, again, that agency is sort of pre-established, right? Yeah. People know these are resources in the neighborhood. They've gone to them for different things. And now to add healthcare on top of that, it really expands what the community partner can do for the populations they serve. And it really makes it so that people know where to go and know what to expect in terms of the engagement when they get there.
And just from your personal experience, Dr. Levy, being a practicing doctor and experiencing patient care on a day-to-day basis, what do you see in terms of working with Black moms in particular in terms of trust? especially when you're not connected to a community group that is trusted. So what does that relationship look like, and how are you trying to cultivate better relationships?
Well, so it's really important to have the front end of engagement be somebody who that person is going to relate to. So what we've done from the very beginning is have community health workers and other members of the community on our team so that people can share the lived experience that they're going through with the person who's trying to advise them in what direction they need to be at. One of the important things that we really stress is it's not just during pregnancy and after pregnancy that's so important, it's before you get pregnant. So a lot of what we want to do is engender or bring out a concept of preconception optimization. So don't wait until you're pregnant to start looking at your blood pressure or your blood sugar or other things. Let's get you healthy before you ever get pregnant so that once you are pregnant, it's going to be that much better going forward.
And I would love to expand on that for literally like 30 seconds or so, because oftentimes we think, oh, the person's pregnant now they have to do this whole 180 change of who they are, how they eat, how they blah. But you're saying, hey, we have to make sure that they're already healthy before this even happens.
Yeah, listen, nobody wants to buy a house with a cracked foundation, right? So you might as well build upon a good foundation. And so we know that high blood pressure in particular leads to cardiovascular disease, one of the most common causes of postpartum complications, and especially maternal mortality is high blood pressure and cardiovascular risk. And so we know that young women, it's a group that tends to get pregnant, right? They're like young men, like whomever. They think they're invincible. They don't have any medical problems. They go through pregnancy and find out things that they may not have known about, but those could have existed beforehand. So if we can measure your blood pressure and measure your blood glucose, your hemoglobin A1C is a marker of long-term sugar. If you're smoking, we can stop you from smoking. Let's address these factors so that when you do get pregnant, you can start on good ground.
On good ground. And before I do let you go, because we're getting down to the wire here, I do want to ask you a little bit about the Wayne Mobile Health Unit itself and its funding through a combination of private and public money. Could we see any funding going away due to what we're seeing at a federal level?
You're bringing back PTSD for me because I think about this every moment of every day because we've done so much for the community. What we're really striving towards is just changing the way people conceptualize healthcare. So we've had tremendous support from the Michigan Department of Health and Human Services, which we believe is stable going forward. I was delighted to see Dr. El Sayed here. He's a good friend, and fingers crossed on his candidacy. But from my perspective, I think we're okay right now. And one of the really great things that's come out of all of this is partnership with payers. We're finally getting payers to understand and be part of the equation. Everybody fears insurance and Medicaid and all that type of stuff, but actually they want people to do as well as they possibly can. So if we think about how payment can be done differently, we can think about how care can be delivered differently.
Awesome. And before we let you go, you're on the ground, you're in the neighborhoods, you're working directly with patients who are at risk. This is our 30 seconds or left, but at risk of complications from pregnancy. What do you wish more people understood about the crisis of Black maternal mortality?
Well, a lot of it can be prevented by getting in for that prenatal screenings, making sure you're healthy when you start, and then after you deliver, keep at it. If you had a high blood pressure or diabetes during pregnancy, don't let it go and keep at it.
Dr. Philip Levy is a professor of emergency medicine at Wayne State University. He directs the Wayne Health Mobile Unit, which is bringing maternal health care to pregnant moms in low-income neighborhoods. Dr. Levy, thank you so much for joining us on the Metro.
My pleasure, Tia.
Metro is hosted by Robin Vincent and Tia Graham. The show is produced by Sam Corey, Carrie Jr. II, and Jack Philbrand. Our senior producer is David Lyons. Our engineer is Nate Bender. Music and creative audio production by Sam Bobian. The Metro is a production of WDET, a listener-supported service of Wayne State University. This is 1019 WDET-FM, Detroit Public Radio, your connection to news, music, and conversation.